Okay, but there are different types of reasons for why it could happen. So I'll put some pictures, and if you can guess it, then say it. If not, then I'll explain it. Can everyone see this picture properly? Can you tell me why this person would have an epistaxis? What would be the cause?
Dryness of skin.
Dryness of the skin. This is the main reason of epistaxis, nose bleeding. The humidity, when there's no humidity in the air, either due to extreme winters or extreme summers, that's when epistaxis are at their prime. Because most of the cause of nosebleeds is because of dryness. Okay? When the mucosa and the skin are dry, the epithelium, they break, it ruptures, it's easier to bleed. Okay? So dryness, this is one of the most common causes of epistaxis, if not the most. Okay. What's this? Hemangioma. It's most common in children, and obviously this is a bit obvious. If someone comes to the clinic, they'll see obviously the tumor is the problem, not the nosebleed, but sometimes they can be very small. Sometimes they can be on the inside as well. So this is also a cause, it's one that you should know. Hemangiomas, benign tumors. Okay? Malignant tumor, sarcoma. Okay, sarcomas of the nose can happen as well. What they do is they deform the nose. This is relatively nice, but sometimes the whole thing can be enlarged. Okay, it's obvious there's a tumor or something involved there. This is not relatively mild, but it is malignant, so it needs to be treated properly. Okay. No, not yet. Fracture. It's a fracture of the nose. If dryness is the most common cause, this is the second most common trauma. Okay, again, this is the anterior epistaxis. But this is, obviously, dealing with trauma is an emergency, but otherwise you can just have even a simple bang on the nose can cause an epistaxis in certain conditions. Okay, so trauma. Fractures.
Polyp.
This is an interesting case. Basically, this was a 26-year-old man, and he basically had nosebleeds again and again. And this lasted for 3 weeks. It's a case of aneuploidy. So when they taken the history, they found he went swimming in this lake basically. This is rhinosporidiosis, fungal infection. Okay? Right now it's easy to see because nose is like this, but otherwise it wasn't very visible. Okay? This is a fungal infection basically. It's caused massive dilatation, slight granuloma formation as well on the side. This is chronic inflammation. Okay? Fungal infection. This is an infection as well by a very common organism, especially air bug. Okay? This